And thanks to our studio audience for joining us today on Delmarva Life. To find out how you can become a member of our studio audience, visit delmarvalife.com, click on the show tab, or you can call the number on our screen, 443-880-9116. It's known as the silent thief of sight, glaucoma, and it can be scary. But if found early enough, it can also be treated, so it's important to understand this eye disease. Joining us this afternoon to help is Dr. Jason Yonker, a glaucoma specialist with Chesapeake Eye Center with offices in Berlin, Salisbury, and Millsboro. Thank you for joining us this afternoon.
Thank you for having me.
Now, first of all, why is glaucoma known as the silent disease?
Well, the difficult part with glaucoma, and you can think of it as a regular patient, we all hear of high blood pressure. And you have high blood pressure, it can lead to heart attacks and strokes, and you may not know you have it unless you're screened adequately. Unfortunately, with glaucoma, what happens is this is the same type of process. It takes away the vision so slowly from the periphery of the vision toward the center that oftentimes patients don't know they have it until it's too late. And that's one of the difficult things we deal with as ophthalmologists. I have such a great field to practice in. We have so many good, successful outcomes with our procedures and with the patients that we treat. But unfortunately, one of the toughest parts of the things we deal with in our office is a patient who comes in thinking they may have a cataract or need glasses, and unfortunately, they've lost a significant chunk of their vision from glaucoma because we didn't pick it up in time.
Right, so you got to catch it early. Now explain how glaucoma works.
Well, essentially, with glaucoma, the easiest way I explain it to my patients is you can think of it as a bathtub analogy. So if you've got a bathtub, you've got faucets that are running, you have a drain that's draining, and then you essentially have the water building up in the bathtub. Well, the trouble with glaucoma is that in a bathtub, if the water builds up too much, it overflows the tub. But in an eyeball, you have nowhere to go. So essentially what happens is it builds up a back pressure, and that back pressure puts a squeeze effect on the internal lining of the eye, which is nerve tissue, and it slowly damages that tissue over many, many years. So it's kind of like having little strokes to the nerve tissue over a long period of time, which is why the patients don't know they have any vision loss until it's unfortunately too late.
And that's what we're seeing here?
And that's what we're seeing here. You can see that on the graph, there's a fluid forms here area, and that's the part of the body that makes the fluid, and it drains into the front chamber of the eye and drains through the drainage meshwork in the front chamber of the eye called the trabecular meshwork, and that's how the fluid gets out of the body. So essentially with glaucoma, you either have a problem where you can't get the fluid through the drain because of it's either blocked or it's clogged up over time.
All right, and you can actually show us what it's like to have glaucoma?
Yeah, I mean, we have several simulators. There's patient simulators online that you can check out. We also have a photograph here, which is normal vision, as you would see, a normal visual field. And unfortunately, this is the way glaucoma starts to take away your vision. And it does this so slowly, these patients don't see this coming. Unfortunately, in time.
Right, right. All right, and this is actually
a
video.
Yeah, this is actually a patient simulator that we provided. Just actually seeing that the visual field is shrinking over time until it eventually gets to that center area of the vision, which is the most important part.
Right, and it happens so slowly they might not notice it. Who's at an increased risk for this?
Well, there's many risk factors for glaucoma. The biggest ones are, first of all, family history. And what ends up happening is we have about a 6-degree increased risk for glaucoma when you have a first-degree relative with glaucoma. Anybody over the age of 60, it gets much more common as we age. Latino and African Americans are also at increased risk of, if you're of that heritage. And then anybody with diabetes or a history of elevated eye pressures.
Interesting. So if you have any of these, you might want to get yourself checked early on.
Exactly.
All right. There are certain foods that can help our eyes. Will anything actually help prevent glaucoma?
Well, the studies will, there's no good studies out there that say there's definitely one thing you need to do, but overall, a healthy lifestyle is something you want to get into. So anything that has antioxidants with it, because a lot of the damage that occurs to the optic nerve, which is the brain, the connection between the brain and the eye, anything that damages that is going to lead to the vision loss. So antioxidants such as omega-3 fatty acids, fish oil, which you see a picture of here, green leafy vegetables. You got to eat your spinach, your kales, your broccolis, your carrots are also good as a source of beta carotene. We'll see.
What about some other preventative measures?
Well, there have been links in the studies to show that exercise, 30 minutes a day, 4 days a week, has been shown to increase blood flow to the back of the eye and also to help lower eye pressure. So it's another good, healthy thing you can do is exercise, and also another big one that we see is smoking. So smoking cessation is a really important part of this as well.
Very interesting. Now talk to us about treatment options for glaucoma.
Well, the great thing with glaucoma is if it's caught early, the majority of patients can be maintained with eye drops. The eye drops help lower the pressures by 2 mechanisms. One, they increase the drainage of the fluid out of the eye, and then the other way is it actually turns down the faucets of the eye. So majority of patients can be maintained with eye drops, and unfortunately, if that doesn't slow down the glaucoma, then we can actually move on to laser treatments, which are kind of like snake in the drain. We're going to open the drain a little bit, and then if that drain is so clogged that won't work, then we can actually move on to surgical options, which actually make a new drain. And we can do that through various mechanisms.
All right, and then surgery.
Yeah, and then that's the surgical option. So essentially, it's a way I explain it is if you think of a heart bypass surgery, you're bypassing, blood from one area to another. And the same things with glaucoma. We're going to bypass fluid from the inside of the eye to the outside of the eye. And we do that with multiple surgical routes. And we use drainage implants. And I think we had some photographs. This is one of the common ones I use, which is called a Barevelt valve. These are extremely small implants, and this is an express shunt, which you can see that little steel implant inside the eye that's draining fluid out of there. So these are microscopic things, and this is another photograph actually showing where the Barevelt valve is implanted onto the back of the eye, and the little tubing is running up into the anterior chamber, which is draining off fluid from the inside of the eye to the outside of the eye in a regulated fashion.
And I understand you're one of the only trained physicians to do this surgery at
Yeah,
Delmarva?
yeah. So for ophthalmology, we do 4 years of medical school and 4 years of surgical training, and then you can opt to do extra training. So I did fellowship training in glaucoma surgery to handle all these different surgical options, and I'm the only fellowship trained glaucoma surgeon living on the shore now.
All right, good to know.
Yeah.
Good information. Thank you so much, Dr. Youngkin,
Thank you for
joining
having me.
us. Chesapeake Eye. Still to come, from your eyes to your teeth. Do you get a little nervous when it's time to visit the dentist? Fear no more. We'll tell you how you can have a very comfortable experience as you try to take care of your teeth.
Next, be fashion forward this spring and summer. Onay's Fashions, here to help you dress your best. Delmarva Live at its best here on Delmarva.